Okay, sure. So, Assalamu alaikum, guys. I hope you're all doing well. I'm Dr. Farah. I will be giving you the first past session about an approach to endoreper block. So, my aim in this session is to help you find a good study approach that suits you well. Of course, everyone have a different study approach that suits them, and you can, especially in first year, you will try multiple approaches until you reach to your preferred approach. But here I'm gonna try just to tell you some tips, and I will give you some resources that you can use. Also, I will help you to identify the high yield topics and lectures discussed with Dr. Faisal, and I will help you, inshallah, to be able to study this block in an organized way. First thing I need you to understand about this block is that it's clinically oriented. So you have to focus on each clinical case that is present, that is in the lecture or in the lab manuals, or any clinical case that is discussed should be very important, and you have to focus on it. This block is clinically oriented, as I said, so you need to have a strong clinical correlation that should be applied to all topics, either يعني, even in anatomy and histology topics. So let's start by talking about the endocrine system. These are the high yield topics that are discussed with Dr. Faisal. So the most important topic is diabetes mellitus, and you have to know everything about diabetes, including all the hormones that are involved. Usually students will focus mostly on insulin and glucagon, but other hormones are also important. Other high yield topics include Cushing syndrome, thyrotoxicosis, hypothyroidism, prolactinoma, growth hormone disorders, and adrenal disorders. You have to understand these topics very well, focus on the anatomy and physiology of these topics, and also if there's any clinical case that is discussed in the lecture, you have to understand it very well. So what you need to know in anatomy is that it's endocrine block, so you have to know everything about the glands and their structures, and of course you need to focus on the blood supply and innervation. For the physiology, you have a lot of hormonal pathways and feedback loops, so these are very important, and you have to understand the interaction between the endocrine organs. Now, these are some resources that you can use for your endocrine block. Of course, your lectures should be your main focus. Some people like to, for example, study from books first and then go to lectures. It's up to you. You have to find what suits you better. But these are some resources that can help you. So, for example, if you study the lecture and you have a topic that you didn't understand very well, you can go for the one of these resources. So you have Teach Me Anatomy, for example, which is really good for anatomy. You have some videos like Noted Anatomist, and for physiology, you have also videos and books. Ninja Nerd videos are really good for hormonal pathways. So if you have something that you didn't understand, you can go and watch these videos. But as I said, your lectures should be your main focus. For reproductive system, these are the high yield topics. So you have infertility with its causes and management. You have to focus on the clinically oriented anatomy and histology also. So, for example, you have to understand if there is a specific epithelial lining for a specific organ, you have to understand why is this the lining for this organ. So you have to have a clinical reasoning for everything that you're memorizing and studying. Also, you have to focus on the female reproductive system, especially delivery and pelvic anatomy. Pelvic anatomy is discussed really good in the labs, so try to study the lab material very well, and they will be really helpful, inshallah. The same thing as I told you, so male and female reproductive organs for anatomy and pelvic structures and histology. For physiology, you have to focus on the hormonal regulation, and for menstrual cycle, you have a lot of graphs, or yani, whenever you have a graph in menstrual cycle, this should be important, so try to focus on it. And you have to understand also about spermatogenesis and these physiology topics. These are the resources that you can use for the reproductive block. So same resources. You have videos like Sam Webster videos. These are good for pelvic anatomy. You have noted anatomists. For physiology, the same thing. You have Boards and Beyond, you have Ninja Nerd. So these are additional resources that you can use in case you didn't understand something in your lecture and you want to go more and understand more about it. Now, you will finish your endocrine lectures, inshallah, by the 20th of February, so which is very close now. So I hope you started already studying your endocrine lectures. Try as much as you can to study day by day in order to finish by the time, because you're gonna have your mole and genetic midterms. So I would like you to be like at least 80% of the lectures should be done before your midterms. Try as much as you can because when you finish your midterms, you're gonna start with the reproductive block, and if you have a lot of endocrine and reproductive lectures, you will feel like overwhelmed. So try to finish day by day lectures and try to have a good time management. Also, guys, lab manuals are very important. Try to finish them before. If you can read them before you go to the lab, this would be really helpful because you will know what are we going to talk about in the lab, and you will be able to understand better. Lab teasers will be provided by Dr. Faisal. These are very important because they have a lot of questions and they have cases, which are really important. As I told you, it's clinically oriented. So every case that is discussed in the lectures and the lab teasers should be very important. So you can, for example, write these cases and try to understand them and revise them more than one time. And a very important advice that I want to give you. So Ramadan is coming, inshallah, and this block is going to be during the Ramadan. So try as much as you can to adjust your schedule accordingly. يعني have time for your worships, have time for your family, and also for your studying. It's doable, inshallah. You just need to have good time management, and you will be able to focus, inshallah, on your studying and focus on everything else. Just have a good time management. These are some study methods that you can follow. So I advise you to study by topic, not by subject or discipline, because this makes more sense. So for example, if you're studying about the pituitary gland, you can study all the lectures related to it. So for example, study embryology, anatomy, histology, and then physiology. And like this, you will be able to build a good clinical correlation about this topic. When you're done with this topic, you can, for example, go and solve a couple of questions to test your knowledge about this certain topic. The questions can be from previous exams or from books. Like, for example, BRS has some questions, Grey's Anatomy also has some questions. So you can go and solve some questions about this topic to test your knowledge. Try to draw. So in anatomy, drawing is really beneficial. Also because in endocrine block, you have a lot of pathways, a lot of hormonal feedback loops. So if you draw them, you will be able to understand better. And especially if you're a visual person, this will help you a lot. So you will understand everything related to this hormonal feedback loop. You will be able to memorize it better and understand it better. Um, I'm emphasizing on clinical cases because, as I told you, this is a clinically oriented block. So every clinical case that is in the lecture or in the lab manual or lab teaser should be understood very well. And you can use the academic aid resources. I added the barcode here. You can scan it and see if you like to use any resource. Lastly, it's only about time management and good studying strategies. So you can use the high yield resources that I provided you with. And it's very important to understand that you don't have to study from all the resources. So just understand the topic from your lecture, and if you want to add more on it, you can go to these resources. You don't have to study from all the resources. This would be very overwhelming. So just find the resource that you like the most and you can study from it. Be an active learner, so draw study cases, practice questions, and if you like to use Anki cards, you can use them. Just find your way. This is also a Notion template for the blog. You can access it and see. They have also a guide for studying. They have different strategies, so you can have a look on them. This is inshallah going to be a simple block, so just try to be on time, have a good time management, and you should be fine, inshallah. Um, Feel free to ask any questions. You can unmute or write in the chat box. Any questions? Okay.